Hi, everyone.
Hello.
Yeah.
So
Today,
what's
testing check. Dr. Lopez, thank you so much.
awesome, Isha? I know you've been with us for a little while.
Yeah. Thank
Y-
you, thank you, thank you so much.
So,
You and your team. I have no words to say thank you. I can't
oh
thank
my God, that is the best thing ever, Isha. I know you're super, super stoked and happy.
you. Yes.
How was the test? Like, do you feel like you were prepared and
Prepared. I was comfortable as compared to the previous 2 times I went there.
so okay. So
Mhm.
Isha,
Yes.
you tested twice, 3 times, right?
2 times.
2 times.
Yeah, today the third
And
one.
this was the third one.
Yes.
What was different this time? What made things happen this time for you?
The first two, I was not prepared. Like
Okay, so what you do this time that made you prepare?
yeah, the second one, like you advise us to say, read, don't just brush through, you know. All
Okay,
what you are saying was the opposite I was doing, and I
okay,
rushed to go. So I rushed to go, even though I was doing well in the test bank and all this, but it's like I was memorizing the questions instead of
okay.
PDF.
Instead of a learning, right? Instead of a understanding.
Yeah,
And,
until after the second one, I came back, I took it, one at a time. I was reading every week, maybe 2 modules, and I will go back and forth, the PDFs, the PDF, the PDFs.
good. So guys, these are good insights.
Yeah,
As I mentioned yesterday, there will be 107 questions for modules 1, 2, and 3. So it's unreasonable to think that you went to the class yesterday and you got everything,
yes,
and maybe you do. But 5 weeks from now, 6 weeks from now, you are not going to remember. So Isha mentioned that the secret sauce is reviewing the PDF, going back to what you learned.
yes,
Because yesterday we clarified most of the things, right? We felt confident that we know the material. But if you don't go back to it, you are not going to remember, guys. I'm promise you. And yesterday we had a lot of people that didn't do well the first time, and everybody's saying, hey, this content is high you, this content is good, please know it. So if you go back to the PDF and review it, your test day is going to be easy. It's going to be a breeze because you did a lot of work beforehand. Okay,
yes,
so I cannot emphasize that enough. It's the preparation, it is what it is hard, but do it one time. Don't aim to do it twice. Do it one time, do it well, do it the right way. Take your time. We don't even charge you. We don't charge you if you stay longer than 30 days. We stay with you as long as you need to be, but we hope that you are actively learning and not passively receiving the information, because that can be, that can be a little hard. And some people are able to do it in 3 weeks, but it's not everybody. Everyone is different, different situations. So please, please, very important that you stay engaged.
and one more thing to add: the sleep the day before the exam or the night before the exam. The
There you
pre
go.
before I go to sleep, maybe I'll be going back and forth to the question bank. I'll be there till 3 a.m. All the
That's
time. So when I go sit in the class, I was like, everything was blurry. So I didn't even know. I was there and I'll be sleeping on the computer. Time I chose the afternoon, which was 1 p.m., but a lot of people were here, so I didn't start my exam until like 2:30. That's
okay.
yeah,
Yeah. Guys, there is no excuses. We had two patients, I mean, not patients, students. Uh, Both of them, I think they were 68 years old.
and I
Honestly, we had two students that were 68 years old that passed the board.
wow.
Honestly, most of us are younger. We can do this, okay? If they took their time. One of them is actually almost blind. She had a retina detachment and she had to have for accommodation. She still passed the board.
Yeah,
So really, everyone can do it with the right material and engage.
I'm
You can do it.
my grandkids, they want to come and say thank you to you. Every day, I run away from there. I say I'm studying. Anytime I will open the computer when they want to come visit me, I say I'm studying. Look at there. their
There you
work.
go. Show up. Show it up. I can't see it. All right. Here we
Anything
go.
when they don't do well, I say, see, you don't give up, persist, continue. Grandma is going to school. So they're like,
All right.
who want to talk to your teacher? Anytime I see them when they come to me, so they won't stay long, I will open the computer. So I'm studying. Dr. Lopez is still.
Isha, I didn't know you're a grandma. I thought you were like 35.
I have 4 grandkids.
Oh my God. What a joy.
Thank you all. I'm so blessed. I'm so blessed to join your class. The team on WhatsApp, they are phenomenal. I want to
Awesome.
be very quiet, but grandma knows what to do.
There you go, Isha. You go be the superstar, and congratulations on passing the board, and taking care of your family, because this is what it's all about, right?
Yes.
As you pass, you're not motivating just yourself, but you're motivating your grandchildren, your children. That I mean, there is no excuse. If Isha can pass and she has a busy life,
Yes.
everybody else can too.
Yes, sir. Thank you
All right, Isha. Thank you.
so much, guys. Please just continue, be patient, don't rush, take your time, sleep enough.
That's right, Isha. I see you very happy. I'm glad.
When you read, lay down and sleep.
That's right.
Thank you so much, Dr. Lopez. I'll send you my email.
Sure thing, Isha. Thank you for being here, and thank you for being part of this community, because it is an extraordinary moment. I now you guys are going to be there, whether it's next week, whether it's tomorrow, or 2 months from now, or even 6 months from now. Don't give up. Don't give up the dream. Be on it. Be on top of it. Okay.
Yes.
Don't be kind of cutting corners. Don't cut corners. That is the most important thing I can tell you.
Don't cut corners, please. This is doable. They are very tricky. The answers will be there, but the way they play around with the words is different from the first exam, from the second exam. Third exam, if you go in, you won't see those words. They're very, very tricky. Because you see the answers. If you do your question bank, you definitely see the answers there.
Okay, awesome. Thank you, Isha. Let me help out the other folks here. Jean Marie, do you have a question, or if it's for me or for Isha or for anybody? Myra.
Yes, Dr.
Hi.
Lopez.
Hello.
Dr. Lopez.
Hi.
Hi. Sorry. I am just pulling into my driveway right now, and I need to turn on my laptop. I'm on my phone. So can you just not start the Kahoot for like 5 more minutes so I can turn on my
5 minutes
computer
is
and
good.
participate?
Yes.
Okay. Thank you
Go
so
ahead.
much. Thank you.
My
Appreciate
pleasure. All right. Myra, are you there?
No, you answered my question already. Thank you, Dr.
Okay,
Lopez.
awesome. Very good. Christine, do you have a question? You're muted if you're trying to talk. So it is almost the weekend.
Yes, I'm here. Can you hear me?
Yes, I can, Christine.
Hi, how are you? I wanted to
Good.
know what's the PIN number. Hi, everyone. What's the PIN number for Kahoots, please?
Are you on your
I'm
app?
doing the app. Yeah.
So right here in the middle of the screen, Isha. I'm sorry, Christine. Do you see it? I'm certain.
No, I can't.
Okay, I'm sorry. 330-6058. My apologies. I figure you're in the meeting and on the app. I put it in the chat. Oh, you're not in the chat box. I'm sorry. 330-6058.
Bye-bye.
Yes, shout out to all the grandmas in the house. That's right. The chosen one. That's right. I'm telling you. That's you, Isha. He's speaking to you.
Yes, thank you all so much. Thank
I
you.
know, guys. These are the best phone calls and emails. As I open my email, 4 o'clock in the morning. I know I'm crazy, right? 4 o'clock in the morning, I am on my emails, and then I see just passed. So these are the best ones. Yeah, sure. I love to answer any kind of question, but those get me excited too. So
Thank you all so much.
my pleasure, Isha.
Yeah, let me leave now.
Okay.
I was messing with your wife. I said I'll be number one on the podium today.
Hey, go for it, Isha. You know, if you want to play, if you know, it's all about you. So go for it.
Yeah.
It is hard to be number one, you know, because Kahoot accounts from being fast and accurate.
Yes.
So it is a very challenging game because there's only 5, and we have maybe what 100 players tonight, maybe lots, right?
Yeah.
So
All right. Let me leave people to concentrate.
okay. All right. Is anyone stuck and does not know how to play Kahoot? B62 with 5 grams. Excited to be here. Yeah. Melissa, you are 62? No, right? Yes? Oh my God. Show up on the camera. You don't look like 62. I mean, honestly, you
Definitely am.
oh my God. Yeah, you gotta tell me the recipe because you look young.
Thank you, sir. I'm glad to be here. Thank you for all your support. It's taken me a while to get started just because of work and school and grandkids and life.
That's right.
But I'm now that I'm out of school, I can definitely start implementing the program that you have. Been following you for a while.
Yeah, no, it's all good. You know, we don't rush people. You know, I mean, I'm not talking bad about anybody else, but we do not rush. We try not to rush and try not to make sure that you guys get what you came here for, right? Get your results. And we don't play the games that we charge monthly and none of this. So we charge, I think, is a very fair price for the work that we do. So
absolutely.
Yeah.
And I'm sure you're going to be greatly rewarded for it. Definitely appreciate you.
My absolute pleasure, for sure. So if anyone, go ahead. Say it again.
I said, I'll see how I do at the game. It takes me forever to read the questions. And so this is why I'm here, to get the practice.
Awesome.
Okay.
Miss Wilson, I know you passed the board. What are you doing here? Who is this? Anima? Tyra? Go ahead, speak. Anima, are you there?
My test is Saturday.
Yeah, I know you passed. So you just come over here to bless us with your presence and play the game.
It's this Saturday.
Huh?
It's this Saturday. The 7th.
You passed, right?
I didn't take it yet. I take it on the 7th.
Oh, you take on the 7th. Oh, okay. Oh, I'm so sorry. I muted you. I'm sorry. All right. I thought you passed. Okay, so you'll be in the next PMHNP. Here we go. It's written. All right. All right. Tips on reading the question. It takes me forever because I read word for word. Tips for Kahoot is different than the test, right? So Kahoot, read as fast as you can and go with your intuition, because a lot of people will get the question right. So in order to differentiate yourself, you have to be fast, right? But be careful. The phone is small and some of us may have big fingers, you know? So you don't want to press the wrong button, because once you do it records your answer. So there is no coming back from that. But ultimately, the real goal is for everybody to learn. Why do we do Kahoot? Well, first, because it's fun. And second, because we want to get you unstuck on reading the question forever. On the test, you read the question, do not look at the answers. Do not. No, I'm not crazy. You read the question and you tell yourself what is the answer. What are you looking for? Because if you do that, it will be much harder to trick you. Right? Because if you see signs of pancreatitis, signs of a liver toxicity, and then you say, these are liver toxicity or pancreatitis, you know what you're looking for. Now, and you got to time yourself. As you go through the question bank, specifically, I believe now only the crash course review question bank, there's a timer there. You gotta answer within the time, right? So you gotta practice like you are going to a fight. It is the test date. So I would say, make sure you read the question as fast as you can and ask yourself, what is the question really asking me? And then answer, and then look for A, B, C, and D. Which one of those options is close to your whatever you said? In order to play the game, grab your phone, open the camera, point to the QR code, and then create a nickname. You know you are in the game once you see your name here. And then once the game starts, I will explain how to really play it. For now, all you need to do is make sure that your name is here. Sometimes Kahoot kick you out because I know some of you guys were in and they got kicked out. So just log back in quickly if that happens. Yes, preferably you join the game on your computer so we can have this conversation, and you play on your phone. You punch in the answers in your phone. And we'll be starting like in 5 more minutes, okay, folks? Just 5 more minutes. I know a lot of people want to join. I don't know if Jean Marie is already in. If you are here, Jean, let me know. All
yes,
right.
I am here. I messaged
Okay.
you. I'm here. Thank you
All
for
right.
waiting.
Awesome. All right, folks. So let's give it 2 more minutes. 2 more minutes and we'll get started, okay? I know a lot of people are coming in. So 1 second. Awesome. Thank you for the patience. We're trying to always get everyone to participate if they want to. So sometimes there's last minute struggles, traffic, and so on, right? All right. So while we do this, once the question shows up, you'll be able to play on your phone. You answer on your phone. You're not going to answer on your computer, okay? All right. Jumi, do you have a question? I'm not sure if somebody has a question. I saw a little hand coming up. No, nobody has a question. Great. You know you're playing if you see your name in here. Dean PMHNP, you've been with us for a while, so you must be ready to test soon. A lot of you guys, I see a lot of names here that have been with us for a while, so good luck for those that are testing this week, next week. Make it a moment to remember, okay? A good moment. All right, folks, let's get started. It's time. Good luck, everyone. Once again, once I kick off the game, you got to play on your phone, answering the question on your phone. You have 1 minute per question. On the test, you have 1 minute and 20 seconds, right? So just make sure you're not distracted. Good luck, everyone. Let's do this. Go ahead, Rebecca.
Good evening, Dr. Lopez. Good evening, everybody. Just to let them, the new people know, do not answer on the chat and do not open your mic. You're not
Yes,
supposed
preferably.
to take the answers, and you're not supposed to type. That's gonna be cheating.
Yes. And then it kind of distracting other people that are playing. So it's better not to put it in the chat. I know you want to play. It's best to play on your phone and participate. Good luck, everyone. Let's do this.
Yeah,
Next
and
time. Go ahead.
Dr. Lopez, whoever's Christopher Mba, I think their camera is on and she was just there naked. So she should be aware of it.
Thank you.
Oh my God, again?
Yes.
All right, Christopher. I don't know who you are, but you know, cameras should be off. If you want to have your beautiful face, it's okay.
Put your clothes on, please.
Yeah, take over your camera. Just
How do
All
you
right,
log
okay,
into
folks.
Kahoots again?
All right, let's do this. Good luck, everyone.
Oh my God.
So it's mostly scientific foundation. Yes. Five seconds. Pick your best answer and go. All right. So yesterday we covered this, right? Neurotransmitters. And when we are talking about Block Carla and the five players there, they made it fast, right? So when we're talking about norepinephrine and serotonin, it really is kind of the most implicated in mood regulation and are commonly associated with mood disorders, right? So it's very important. Yesterday we said which neurotransmitters are mostly associated or what you think of them. Think of that as you're answering those questions, whether it's OCD, Alzheimer's, doesn't matter, right? Tourette's, ADHD. We got to know which neurotransmitters are involved or mostly involved. Next question.
Come on, Daddy. McDonald's might be just ice cream, man.
Let's see, what does this?
All right, 20 seconds. All right, yesterday we hop on the reduced renal clearance, right? So if someone is taking alcohol, they may have reduced or decreased renal clearance. When anything that affects the kidney, it may affect lithium levels. We should be concerned with ACE inhibitors, ARBs medications, NSAIDs. These are things that are likely to be on your board, so we got to know those things, okay? So alcohol can really affect lithium levels. But what else? Think of dehydration, right? That could also affect lithium levels, especially due to alcohol. Twenty seconds. All right, so good. So hopefully my joke yesterday kind of worked, right? I said, if you have a patient that is stable on a mood stabilizer or antipsychotic, and they want to change their medication, and if they're stable and the medication is working, put them on a treadmill, right? It's a joke, folks, okay? So what you need to do is lifestyle modification. Don't be changing to the skinny antipsychotics like Abilify, Latuda, or Geodon. These are good options if the first recommendation doesn't work. Is it only for antipsychotics? No, it's for all medications. For example, someone is having insomnia and taking Prozac. Well, ask the patient what time is he taking the Prozac. If you can change the Prozac to the morning, it could help the patient, and you do not need to add another sleep aid. Okay? All right, so anytime you see the word persistent, it doesn't stop. Constant, excessive, that all leads to one thing, guys. I promise you, it is likely to be toxicity levels. If you have toxicity levels, what you should be the first thing you do? Assess for other signs of lithium toxicity and adjust the dose if appropriate, right? In response to your assessment of hand tremors. Remember, cursed hand tremors, you can see if someone's having persistent hand tremors is likely to be associated with toxicity levels.
So the answer wasn't to stop it, it was to assess.
Oh, can go back here. All right, 9 seconds. Okay, so blood test for lithium should be done at the same time each day. It doesn't have to be precisely, right? But you want to avoid collecting labs immediately after taking lithium, right? So preferably you want to have the 12-hour trough levels, right? So consistency is the key for lithium levels fluctuations throughout the day is based on the last dose that was taken. So the key here is that it doesn't have to be precisely the same time, but in the morning and having, as long as the person taking the medication at the same time, would be consistent. Okay. Right, 20 seconds. Five seconds. And go. All right, take with a full glass of water to aid absorption and reduce GI discomfort, upset, or symptoms, right? So one thing I have to say is that lithium can have several types of symptoms, right? Whether it's maculopapular rash, can have symptoms related to kidneys, and can have symptoms related to GI. So, such as nausea, diarrhea, things are related to GI. And yes, having a little bit more water, it helps. Okay. Okay. So I was hoping that no one would pick the green, right? This is an MAOI, has nothing to do with lithium, right? Maybe it was a mistake. I hope. Okay. Now the blue option is reasonable, right? We want to do antihypertensive medications, but are you still going to give the MAOIs? No, you have to stop the causative agent first, immediately. That would be the most appropriate action. And then, obviously, you give a antihypertensive medication. Ten seconds. Three, two, one. All right. So I wouldn't say it's safe. I would say safer compared to other mood stabilizers.
Dr. Lopez.
Yes.
What about what's it called? Lorazepam. Is it safe too?
I wouldn't say safe, but maybe safer than other antipsychotics, right? But the deal here is if someone is pregnant on Depakote, carbamazepine, or lithium, you stop the medication and you transition to lamotrigine. Is the safest mood stabilizer. And in real life, you really have to compare the risk versus the benefit, right? What is the risk? Someone maybe being psychotic, it might be worth keeping the patient on the medication, right? And glad that nobody pick, give a benzodiazepine. You have to be concerned of what?
Floppy baby.
Floppy
Floppy
baby.
baby. And what else usually?
Cleft palate.
Yeah. Yeah, both, right? So both things are related to benzos, right? And of course, alcohol would be alcohol fetal syndrome. Okay, we got 10 seconds just about. Four, three, two, one, go. All right, we want to discontinue Depakote immediately in order liver test, right? We hopped on this a lot yesterday. Now, questions in which someone might call and say, hey, I'm having X and Y and Z symptoms, whether they are, whether they are liver toxicity or pancreatitis, your goal is to direct the patient immediately to the ED. Okay. Yes, we do not assess kidney functions by assessing liver options. Okay, we do not collect the white blood, CBC. Electrolyte is important for lithium, and this would be important for lithium, but this is not how we assess kidney function. And I know somebody's thinking about hypo and hyperthyroidism, but this is not how we assess kidney functions. Folks, I trust this was a mistake, and some of you guys really picked the wrong answer by mistake. If that is not the case, we have some work to do. And I say this in the bottom of my heart. Do it in a way that you will pass the board, okay? So we have to assess kidney function because lithium is excreted by the kidneys, right? And how do we assess kidney function? Mostly creatinine and BUN. There are several other ways. GFR, all that can be taken in consideration. If someone has a protein in the urine, we assess the patient and may continue the treatment. It does not mean you should absolutely stop, but it definitely would be a yellow light. ask yourself which lab is out of order, right?
He's muted. You're muted, Dr. Lopez.
Oh, no, I'm just not talking. I'm not muted, I don't think.
Oh, okay.
All right, 2 seconds and go. All right, so this is slightly off, right? It's 135. So creatinine is the same level as lithium, 0.6 to 1.2. Yesterday we talked about the happy age, 10 to 20, BUN, and thyroid hormone levels, 0.5 to 5. So which lab is slightly below expected range? Which one of those labs we would be concerned? We would be concerned for hyponatremia, right? So 135 to 145, it is your lab to know in relation to sodium. Okay? All right, so we talked about really all antipsychotics, not all, but mood stabilizer. We really need to give folic acid because we are concerned about neurotube defect, right? It is a good practice, females that could have children 12 to 50 years old, right? It's a good practice to have folic acid. Now, I'm not saying a 12 years old should be thinking about having kids, right? Folic acid would be a good supplement for those that are at the, that could be having children and actively engaged in that sense, right? So please, that is very important for the fetus, right?
The music is not on.
All right, thank you, appreciate it. All right, 10 seconds. All right, I thought somebody would pick the blue, but nobody did, so congrats. Nobody picked prescribed stimulant, laxative. We don't want to make things even worse. Now, initiate a cognitive behavior therapy to address the maladaptive eating issue. That is a tempting answer. But then again, is that an action? Would that be better than assessing? Assessing first to determine Mark's dietary habit. So again, it's back to the nursing principle of assessment first, or any healthcare provider in that matter, before initiating a action. Okay? All right, 5 seconds. Yes, so we want, which one of those answers screams bulimia, right? We have the red option, severe restriction of calorie intakes. And then we have the B, experience intense fear of gaining weight. That is not bulimia. It is more likely to be anorexia related, right? And then we have the orange, engage in excessive exercise without focus on caloric intake. That could be a sign of bulimia, but it is not better than consuming large amounts of food followed by guilt and purging. That is the hallmark of bulimia, taking laxatives and self-induced vomiting, right? All right, yesterday we said that you need to know the acronym for inhibitors and inducers, right? And we need to know the medication that can cause mania and the medications that can cause depression. We went over this in detail yesterday. Now, let's say you totally forgot about it. Most of the time when you have antibiotics, they are inhibitors. Vancomycin, clindamycin, right? Erythromycin. These are inhibitors. So here you have doxycycline. What it's going to do to Targadol, right? So it's not what Targadol is going to do to doxycycline. The question that is mostly concerned. Somebody has a question on this? Go ahead, Roberta.
No, you just answered because I was thinking about the Tegretol as being the chief inducer, but you're right. The answer is the question is not asking that. So
Okay.
Yeah,
Thank you.
absolutely. So, yeah, if the question was asked what Torgadol is going to do to doxycyclic, then I would be concerned with whatever infection they got going on. It's not going to be taken care of, right? But it's asking really what doxycycline will do to Torgadol. So, very good question. I would know that question very well, by the way. Yesterday we talked about the most abundant and the chief inhibitory. Hopefully we get 100% here. All right, perfect. I was hoping for 100%, but not yet, right? So the chief excitatory neurotransmitter is glutamate. It's the most abundant of all neurotransmitter. And the chief inhibitor is the calming GABA, right? So these are very likely high yield questions. It's asking about balance. All right, so let's say I did not know that the cerebellum was responsible for balance, but it's asking me which of the following options is responsible for unsteady gait. I would look at this answer and I would look for something motor coordination and balance. The question said it right there. It is not has nothing to do with the limbic system. And by the way, you need to know all the limbic system. That could easily be 5 questions from the limbic system alone. And dysfunction in the cerebrum affecting cognition. Are we talking about cognition or modem? And dysfunction in the brain stem affecting respiration. Folks, even if we didn't know the answer, right? We could guess this one by looking at the possible choices. The only answer that has modem coordination and balance is the blue option. And that is a high yield question, even though it was super simple and easy. Okay? Don't let this affect you, but let this be a warning sign that there is some work to be done and we should not cut corners. Because if we do, we are likely to pay the price. Okay? And that is the only message that I'm trying to bring it to you before it's too late. Okay, very good. We need to know the frontal lobe, parietal, temporal, and occipital, just like the limbic system. These are very easy and high topics. Okay, we talked about visual hallucinations. A health eye sight, but still being blind. That is part of the occipital lobe imbalance or dysfunction in that case, right? If you don't know the lobes of the brain, it's probably another sign that we need to get on it as fast as possible, okay? Okay, hopefully we get 100% on this one. Atypical, from atypical antipsychotics from typical antipsychotics. Six seconds. Okay, I get it. So we had a very long discussion, maybe day one or day two from yesterday's event. Atypical antipsychotics has something special. It's called the 5-HT2A receptor antagonistic or serotonin antagonistic receptor. That causes, those medications cause less EPS, but more metabolic syndrome. We went over in detail on the limbic system, the dopamine pathways, and the reasons why adding the 5-HT2A serotonin antagonistics helps to increase a little bit more dopamine on other pathways and causes less EPS. Very important concept. Guarantee you, I'll bet you $100 you will see tons of questions on the dopamine pathway. And this is a question you need to mark it down. Why is a typical antipsychotic special about it? Okay, I know that the blue could be attempting, right? Niger striatal pathway. Is this happen on the Niger striatal pathway? And then due to reduced dopaminergic transmission. But listen, we're talking about the tubular-fundibular pathway, right? So we need to know those pathways in details. In the tubular-fundibular pathway, when dopamine is down and prolactin is up, we have those symptoms of osteoporosis. Osteoporosis. That is something you should know, okay? osteoporosis, gynecomastia, galactorrhea, sexual dysfunction, amenorrhea, all that is due to the imbalance of dopamine and prolactin. Now, what if you had a question just like that and would say, due to prolactin being up or blockade, depletion, low levels of dopamine? You pick the second option. That is the first piece of the domino effect, and there is an answer that is congruent with the dopamine pathway. So you answer in terms of dopamine. If you don't know what I'm talking about, stay back. Once the class is over, we'll go over this. But it's very important. It's a dopamine pathway. You answer in terms of dopamine, unless if it's specifically asked. What's the other neurotransmitter involved? In that case, you answer either acetylcholine, prolactin, or so forth. Okay, I wanted to bring this question up on purpose because it seems that a lot of us are getting akathisia confused with cogentin, right? Cogentin and propranolol. If the symptom is akathisia, which is similar to restless, right? Then the answer, it is propranolol. I did this on purpose because for 2 days in a row, I had the same question. So I want to make this very, 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 very clear. And if you have a question bank, a question in the question bank that says otherwise, I need to know the number because I have thousands of questions. But this was on purpose. So let this be a teaching moment. And remember, akathisia, right, causes symptoms of restlessness, and you want to give propranolol. Now, if propranolol is not there, then the second best option would be benzotropine, cogentin, okay? But please, if propranolol is there for akathisia, pick propranolol.
Dr. Lopez.
I can't stop now, but we'll go back to that in a second, okay?
Okay. Yeah, these questions are very small.
It's fun, yeah.
You know what I'm going to explain?
It's true.
It's true.
Hope you guys can see the question there.
No, the question is so small.
You can't see the question.
Make it bigger, Dr. Lopez. I can't see.
I can't. A 54-year-old female with a history of breast cancer is currently taking treatment with tamoxifen. So basically, it's asking which of the following SSRIs would be the best recommended for this patient. Which SSRI has the least drug-to-drug interaction?
Got it. Thank you.
I simplified. All right. Sorry. I thought that the question would be a little bit bigger. So you want, out of those choices, what do we have in common? We have Prozac and Praxil, which are strong CYP2D6 inhibitors. They are contraindicated with patient taking tamoxifen, which is a cancer medication, because they block or could block the clinical efficacy for those medications. So no, we can now give those two medications. And also, actually, the three medications are CYP2 for 2D6. Now, what can we give? Lexapro would be the minimal or least drug-to-drug interaction for this medication. It allows tamoxifen to be metabolized correctly to its active form. Now, two things about this. Medications that can cause depression, we said those patients with cancer medications. That's why it's important that we know medication that cause cancers, mania, and depression. Second thing, what if Lexapro wasn't there? What else can we use? We can use its cousin, citalopram, or sertraline. Now, what is the problem with citalopram or Celexa?
QT prolongation.
Yeah, QT prolongation. I don't care about anything else. Actually, I do care about one more thing about citalopram. Citalopram, not escitalopram. They could also cause a paradoxical effect, actually all SSRIs in older adults. But I would be more concerned with the older adults on citalopram due to QT prolongation. That is probably the most high yield and the only thing that I have to say about Celexa or citalopram. But remember, what if the question is Lexapro is not there? Then certainly it would be a good question. Now let's go back to the proponent law in Akathisia. I know some folks had some questions on that. What was your question?
Dr. Lopez, my question is, so I don't know, I feel like I read it somewhere, but if there is no option for propranolol and there is lorazepam, do we ever give lorazepam for akathisia?
The answer is yes.
Okay.
But we should not, right? It is an option. Hopefully you are not put in that spot. You can, but the reason why we should not is because it's habit forming. Now, the best option would be propranolol, cogentin, and unfortunately, lorazepam. You know, guys, I rarely prescribe benzos. Very, 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 almost never, maybe once a year. That's how rare I prescribe benzos, okay? It is dangerous because it works. It works very well. And anything that works that good, the body's going to love it. Now, guess what? Taking them out of those medications is hell for them. And for us too, because we don't want to see them suffering, right? All right. Any other question? My
yes,
pleasure.
Dr. Lopez.
Yes.
I think part of the confusion about whoever may have chosen cogentin is in the modules. When you talked about akathisia, you actually said benztropine is the first distance, you know. I did that stuff and I listened to it.
That's what
except I'm listening to an old one, but you said cogentin is good first line of distance for all the four apart from TD.
True, mostly true. But let's go back to the PDF real quick. It is highlighted in very big letters.
PDF, not the distance, the lecture itself, the video.
Yeah, I mean it can.
Or maybe you're talking about akinesia. There is akathisia.
Yes.
No.
Akinesian, yes.
Akathisia, akinesia.
I mean,
you said cogentin for the.
It is not. It is not wrong.
Yeah.
Hold on, folks. It is not wrong to give cogentin. Not straight up wrong at least. But the best medication is propranolol for akathisia. Okay, so it's not absolutely incorrect. But if you are to pick between both of them, you pick propranolol for akathisia. So because it's the second time somebody asked me the question, I wanted to bring this up and make it as clear as I possibly can. So now let's go back here. Hopefully you guys can see it. Let me bring this one. Okay. So if we go back to, oh, why is it not moving? 1 second, folks. I just want to go back here because I want to show you exactly where it is located. And we can put this debate and hopefully everybody gets the question right, right? So let's see. And yesterday I specifically point this out because it's a point of confusion, okay? Limbic system, we got to know all of them in detail. That could easily be 5 questions right there. I even highlighted for you guys, right? So what else we talked about? We talked about all the brain lobes, all the lobes. We talked about the cerebellum yesterday in detail, right? Responsible for balance. Talked about the cranial nerves in detail. We specifically emphasize those that you must know because they are high yield. We talked about the difference between typical versus atypical antipsychotics. So all these questions we kind of went over a little bit. Talked about the dopamine pathway. Here we are, extrapyramidal side effect. Acute dystonia, we give what? Cogentin or a antihistaminergic medication such as Benadryl, Cogentin, right? So we got it right here, highlighted Cogentin. Acute dystonia, another type of acute dystonia is oculogeric crisis, is an emergency. What do we give? Cogentin. Akathisia, restless, pacing, standing still. The feet is constantly in motions, like bug is crawling out of the skin. What do we give? Propranolol, second best option, Cogentin, and the third, benzodiazepine. Okay, so it's okay to, it's absolutely okay and preferred that we get those questions wired out, get those questions out of the way early. The more mistakes you make now, the better it is for the test, right? What we don't want to do is think that we're G to G and we make those mistakes on the test, and that is not good. So we got to prevent those mistakes. How do we do that? By doing the question bank early. So we find out what we don't know early. Okay? It was on purpose because I had 2 people asking me the same question in 2 days. So I was like, let me create the same question in a different way. All right, so let's go on. Anybody has any question about this?
No.
No? Okay, good. Let's do the next question. Ooh. All right, those 5 players are taking the podium for now.
The same problem, Dr. Lopez. You can't read that.
Oh, I'll read it. Let me see. A 42 years old construction worker with bipolar disorder, screaming, right? Has been stable on lithium for 2 years while working on a double shift 95 Fahrenheit in Florida. He begins feeling dizzy and nauseated. He sits at a shade and his wife provides him with a banana and a large electrolyte sport drinks. Which of the following is the most critical teaching point for the PMHNP to provide to this patient? What do I care? about lithium? That is what the question is asking you. What I care about lithium is sodium and hydration, right? So the questions will not be as simple as this one. We need to know what kind of teaching we provide to the patients. If you go camping, hiking, playing soccer, running a marathon, sure, potassium is important for your heart, but lithium cares about sodium, okay? And being well hydrated. Okay, friend, took the first place. Good job. Oh, this is a little better.
Hello, how are you downstairs?
I know if I don't sleep, I get angry, but that's just me, I guess. All right, so that is the angry amygdala, right? And the hypothalamus is responsible for your circadian rhythm, hormonal regulation, temperature, body temperature, water, hunger. That is your hypothalamus. Anybody has a question on this?
Nope.
No? Okay. We're moving on. Do you have a question? No, this is a simplified type of a question. Very simplified. What the heck? Yes. The acronym that we need to remember, hypothalamus. But the content, absolutely. The question will not be as simple as this. But we're doing baby walks, getting the content, and then we proceed with the harder questions on the diagnostic test and the crash course review questions in the question bank, folks. Not those questions that I sent before the crash course review. In the question bank, we have very complicated questions that you must do if you want an extra 30, 40 points. Okay? I'm telling you guys ahead of time. Save time on your schedule to get those questions done. You want an extra 40 points on your task? Do the crash course review question bank. All right, if we think of a dopamine, dopa and GABA for addiction. Dopamine is made in the nucleus accumbens and the VTA area primarily, right? And it kind of provides the rush, the pleasure associated with substance abuse. GABA is the primary inhibitory neurotransmitter that often modulates dopamine pathways. Many of the addictive substance such as benzos and alcohol are specifically target at GABA. So if you see dope and GABA, think of addiction, right? If we think of a serotonin, anybody pick serotonin somewhat? So if we think of a serotonin, really is involved in mood and impulsivity, right? It's not primarily driver for real world addiction. Norepinephrine and glutamate, right? Those are involved with the conditions such as cravings as of addiction. And norepinephrine, it is the fight or flight. And the acetylcholine is all about memory. If I think of acetylcholine, the first thing that comes to my mind is Alzheimer's and muscle contractions, and not the real world system that we see with dopamine and GABA. Oh, here we go. You didn't even know I had the answer. All right, so this is it for today. So let's see who got the podium. All right, tip 2026, Kathy. And first place. All right. Good job, friend Kathy. Taji and Ola MP. Guys, it's very hard to make the podium, right? It's very extremely hard. So if you didn't make the podium today, your goal is to make the podium next time. But everyone really should be very proud of yourself if you learned something today. I'm glad that you came. We have a lot of folks here today. So what do we need to do this week? We need to finish Question Bank Module 1. Okay, maybe you are doing Module 5 on your own. So your goal then would be to finish Module 5. But if you started with us, thank you, Mary. If you started with us, which you started this week on Module 1, your goal is to finish the question bank on each week. Whether you are finished while you're going live or on your own rhythm. One question bank on one module per week. That will give you enough time to go through the module, go through the PDF, and consciously taking those practice questions. You know, active working is a lot better than passive or just listening to the videos, okay? It's very, very important. So now if we look at our question bank, let me just stop sharing here for a second and share with you our question bank.
Hey sis,
It's very important that you do your crash course review question bank. It's right here. They are different than the 600 questions that I sent you guys on the crash course day.
I didn't see that,
questions,
Dr. Lopez. I didn't see
mean?
that.
I didn't receive a crash course questions either.
Yeah,
Okay, we only send those out on the crash course review week.
Okay.
Because those questions are preparing you guys for 2 days, 20 hours of lectures, so you guys can have a read and practice ahead.
Okay.
But these are super high yield. The crash course review questions, they are very good to engage the material, to learn from mistakes. But these questions, no one should skip them. If you want an extra 40 points on your test, you're right here. Now, I also did more questions. They're called supplementals, right? So you have lots of questions here. We can go through some of them right now, right? Kind of like similar questions. If you need more practice, you can come over here and do those supplemental questions, right? Lots of questions, thousands of questions. So there is no shortage. Yeah, there is no shortage of practice, right? And I also implemented the clock because at this stage, as you've gone through here, time is important. So you have a little bit of timer here. It should be like a 1 minute, but I give you guys 2 minutes just in case, not to rush anyone. On the test is only 1 minute and 20 seconds. So please do those questions, please, please, please. They're very important to you, and I want to see you pass, okay? I absolutely want to see you pass. All right.
I completed all those questions.
Amen, Nita. Well, way to go. So I'll be adding questions over the weekend, most likely, on the crash course review. Every time I'm adding questions, every single time. So if you completed them and you're like, what else can I do? I'll bet you if you go here later, you will find more questions to do, because I'm always adding more questions, right? I can't always say, hey, I added 100 questions yesterday, but just always go back and get those questions going. As you see, they're high yield, right? They're a little bit longer, they're a little bit more complicated, but as you go through them, you see that they are high yield.
Yeah, they were. And I took my diagnostic test 1, 2, and 3. So I have 4 left to do. Number 4.
And no one should ever skip the diagnostic test. These are your secret weapon. Okay, your diagnostic test. I have so many people coming back and say, wow, very
but I
good.
only scored in the low 80s, like an 84 on one, an 86 on another one.
That's good. You know, we're not looking to be perfect. We're looking to pass the board. So, all right, folks. So what we'll do now is we'll answer any questions that you have about the course, about anything that's in your mind. So let me stop the recording here. Did I already stop the recording? Stop the recording, and then